So I'm Travis. I'm a physiotherapist practicing out of Vancouver, Burnaby in Surrey. And I'm here to talk to you a bit about a common topic that a lot of people have questions about and a lot of people think a lot about, which is posture and mobility, and sort of more so how it relates for your day-to-day. So for instance, office workers, how they think about posture, what kind of pains and aches they have, and what kind of things they can do to mitigate those pains and aches or even just to prevent them. Also people who stand for work and all sorts of work, but it's more focused on simple education pieces and tactics they can use throughout their work or day to day to prevent and manage and help with pains, aches, and other. And Cam?
Yeah, so essentially what I really want to outline here is the difference that Travis personally made for me. Now, what you might not know is I have 24-degree thoracic scoliosis, and that's just fancy words of saying that my spine makes me want to do this, and I was born with it. And you know, it's led to a host of pain from school, sitting there in pain. You know, in work, I worked in produce when I was a teenager, so putting out the vegetables in pain. And pretty much everywhere. Go to exercise, I want to go like this because that's the way that my spine is structured. So Travis was my workout partner when we were living in North Vancouver. And he made a huge difference for me by advocating for what's called thoracic mobility. Thoracic mobility is improving the mobility of the thoracic spine, which is below our neck area and just above our lower back area, so like that middle part. And when you improve that mobility in that thoracic region, specifically if you're a student, if you're an office worker, or if you are having all this pain that, you know, it might be showing up in your shoulder region, it unlocks the limitations that were facing you before so that you can do the things you want to do. And so when we were working out, what you'd see is like, I'd do a movement and it would be like slightly painful, and Travis would be like, don't worry, Cam, like we can do this mobility and we can progress it slowly. And so it gave me a lot of hope for my own self, and I'm a personal trainer. So sometimes I would hold that inside, but really it is emotional when you are limited or feel like you're limited. And so what this conversation is going to be a way that Travis can actually, from his practice, display the evidence-based ways that we can actually collectively, as busy professionals, be impacted to have better lives, to have more function in our lives. And so Travis, he's going to go over some of the different topics where there are misconceptions actually about posture. One of them that's really interesting is about slouching, where it might not actually be as bad as you think it is, right? And so he's going to speak towards that. And Travis, take it away. And then after that, we're actually going to hear from you. We're going to hear some of the different things that you deal with. And then Travis is going to be here to empower you and to empower us so that we can be more mobile and more functional in our lives.
Okay. So to lead off of slouching is not so bad, which a lot of you are probably like saying, hey, what does he mean? I've been told it's bad my entire life. So a hard to swallow pill coming up is that the evidence states that posture, when it relates to back pain specifically, is not correlated with pain. And so what do I mean by that? Isn't sitting bad? Shouldn't we demonize it? Well, the short answer is no. And here's what we think now kind of recommend to people as opposed to telling them to sit, perfect 90-90 on Google all day, right? Who thinks that is really who's gonna be comfortable doing that, right? Probably no one. It's not even bad in and of itself, but you're probably not able to hold it for 8 hours. So the current evidence actually suggests that what we focus on when we sit is to vary your posture throughout the day as to not stay in one static position for too long. So that's why Cam said it's not actually bad to slouch. So if you're feeling tired sitting up in your chair and you feel like you need to slouch, well, that's because you probably should. Give yourself a break. Or if you're feeling tired sitting, maybe walk around and go for a walk if you have the means to do it, right? And I know not everyone can be doing jumping jacks and doing squats all day long when they're focused on their work day. But I'm kind of here to empower you and give you back confidence to sit or stand or be in your workplace and hopefully help to manage those symptoms. And I'm even going to show you a few really, really simple examples on how to actually implement that as well. So first of all, does anyone here have any ideas on how they should be sitting, or have heard some of these things about sitting up straight, or how their posture is bad, or have any thoughts on that as a sitting busy professional? Yes.
I'm small, so my feet's always hanging, like my legs are. So usually, it's 90 degrees on the knees and hip, but it feels more comfortable for me to have that. So usually I would put, let's say, a stool, for example,
Mm-hmm.
and I add like maybe a block, like a yoga block on my back. This is when I'm working.
Yeah.
On the computer. And then, it's mostly 90 degree. Yeah, you're right. That you gotta allow yourself to kind of relax, because, this one can be tiring, right?
Yeah, exactly.
It's literally, even if you're aware, like you put your shoulders back and you're like sitting straight, it can be tiring. So yes, that's right, that you're allowed to slouch. But what normally I would do is I will stand up.
Perfect.
Right? If you're working on a table and your lockup's right there, so obviously when you stand up, then right?
Yeah.
So you gotta find a way to bring that lockup on the level where your shoulders are relaxed. So that's normally how I will pull that.
And so it sounds like you have a good setup that's comfortable for you, but you also tend to vary position. And that's a perfect strategy, and bravo to you, especially the variance. And I think it's the variance of your posture that kind of keeps the joints and muscles healthy and happy. And when it comes to ergonomics, I'm not saying that the posture and ergonomics, you should throw them out the window. But just like you do, you should use it as a comfort thing. If you feel more comfortable being in that position most of the time, well, then that should be where you mostly sit. But it doesn't mean you should sit like that or be forced to sit like that for 8 hours straight, right? So you gave a perfect example of you varying your posture, changing your desk, changing it throughout the day, standing sometimes. You can reduce your discomfort throughout the day. Which brings me to another interesting common thing that people get put in is sit-to-stand desks is another great example. It's not so you should stand all day. In fact, a lot of people get pain if they stand in one spot all day, such as a cashier. So if you're able to even stand for 30 minutes, you get tired, then go take a break and take a slouch. It's not so bad. So you have a balance between ergonomics and comfort, but also you want to really focus on, again, as I repeated many times, varying your movement throughout the day, whether by changing positions or the exercises I will show you in a few minutes, or creating your own strategies, right? Another secondary way to mitigate your discomfort at work, it's actually shown that outside of sitting, if you perform more physical activity, you can also mitigate your discomfort, spinal pain, what have you at work. So by adding a combination of varying your movement at work and trying to increase your physical activity outside of work, you can optimize your health and as it relates to discomfort at your workplace. So let me just go ahead and show you a few examples of ones that someone, for instance, that's sitting, and they think, how can I move? I have to focus all day. I tell a lot of my patients or clients to use these as they can, up to twice, every hour if they have the time. If they miss it, no big deal. For instance, maybe I should, let me see if I sit right here. So I'm at a desk. For instance, you're feeling a little sore and stiff, and you simply cross your arms across your chest. And this is what Cam talked about, right? Thoracic. You can try it right now if you want. It's really simple, and it's really simple so you can use it all day if you need it, and not have to get out the video and check how to do it, right? So you're simply going to rotate through your back. If you have any pain doing this that's you're worried about, maybe do it a little less, or just don't do it currently, because this is a general exercise. So what you're doing is you're just going far enough to feel a stretch in your back and maybe your shoulder area, and mobilizing. So say you were sitting for an hour and you're feeling stiff, you can do some of these. And one of the important things to note is some people just do a couple, right? And then they stop and they go back. But really take a sec, do 10 per side and have it a little bit regimented, right? Try to do it once or twice an hour and see how that affects your discomfort or pain at work. It could make a 20% difference, it could make a 40% difference or more, depending on your current, your situation. Another example, I'll turn sideways here, is another thoracic mobility exercise. And it's also fairly simple. You support your neck with your hands, and you're just looking to arch your upper back. It'll also arch your lower back, and then come back to neutral. So you're just repeating it gently, looking for a tightness in your upper back. It'll probably feel pretty good. It might stretch your chest too. And this one will feel particularly good for office workers or people that sit, because it's sort of like giving your joints a little bit of variation the other way, where they don't usually get to work and they like to go all directions. It keeps them happy and healthy. Is it going okay? And I'll teach you one. So that's thoracic rotation, and extension was the second one, bending back, rotating. And another good one, because we sit a lot with our heads forward, is simply sit up tall with your chin a little bit tucked, and you just bring you try to create a double chin like this. You kind of come back. And it's not throwing your head back, although that's not a bad thing either. It's coming back like this and repeating. So these are all spinal mobility drills that you can do throughout the workday, whether you have a standing or seated job. I'm just giving a seated example. And you don't have to do all three every half an hour. You could maybe pick one each time, or the one that you like the best. Or you can look up Google exercises and do other ones that you like. You don't have to follow. These aren't like the only correct ones. They're just really simple examples you can use all day. Or if you, one other example is if you have a standing job, like you're a nurse or a teller or what have you, you could even do standing up versions of spinal extension or rotation, right? You simply just do this, and instead of doing a couple, you try to go for 20 or 15 and really do it regularly every half an hour to an hour if you're able to, right? So spinal extension, and you can even do the rotations, right? So it's not about complexity, it's about consistency and keeping your joints happy and healthy, because joints and muscles, in a nutshell, they like to move, and when they don't move for too long, they start to feel achy. You can feel it in yourself when you want to roll your shoulders when you've been sitting watching TV for too long. So yeah, in conclusion, your best posture is your next posture, is what they say. Motion is lotion. Keep yourself moving throughout the day and try to get physical activity as much as you can outside of your potentially repetitive or sedentary work.
And just to add on to this, because some people might be thinking, like, well, you know, the books need to be done if you're an accountant, or I don't know what accountants say, whatever they say. And you know, if you're a coach, you know, you're like, oh, I gotta sit here on another call with a client or whatever. Like, when you look at the exercise as completely displaced from your actual activity in your day-to-day life, often it can feel impossible to actually take action. So another recommendation, and this comes from me, and also something that I illustrated earlier when I was speaking about the impact Travis had on me. We were at the gym. We were already at the gym. And I had a moment where I realized that there was a lack of mobility. And so instead of seeing it as that separate activity that could be done, we actually integrated the mobility into the workout, right? Now, if we take that concept and we bring that into the workplace, how can you actually implement these types of mobility exercises to be a part of your workday? Not as like an escape from the workday, but to literally be this seamless, integrated thing. And you know, everyone here who's considering that question will have a different answer. And for example, if you have coworkers, it could be that you guys have, you know, a ritual together at the end of lunch that you go and do these activities together. The sky's the limit, and you get to be creative. But what I wanted to add in, and something that Travis really brought to my attention, is the notion of making it your own, the notion of finding your own path to create the mobility that will work for your life, and not allowing you to be stopped by that feeling of limitation. And just always remembering that on the other side of it, motion is lotion. And what was the other one?
Your best posture is your next posture.
That one. Sorry, I couldn't remember the last one. So.
It rhymes.
And with that, we're going to throw it back to you all. If there's anything that you want to ask, if you want to bring to our awareness from your occupation, from your life, and what types of stresses exist for you, there's an opportunity to share with everyone so that we can all hear what possibly would work, you know? Daniel?
Yeah, I was curious. Yeah, I'm curious. My question is, I noticed as I am doing more work on the computer, I'm leaning against my elbows and arms on the desk.
Mhm.
I'm wondering, because I've been wondering, how is that affecting my body, and what are some exercises to counter maybe that? Because when I notice when I sit up or I stand up and move around, but I'm just curious just to get some expert information of what part of the body may that be affecting over long periods of time.
Leaning against this?
Yeah, if I'm just leaning because yeah.
I mean, you may be spending too much time in thoracic kyphosis forward. So for example, if I were to draw from our exercises, you could even do this one, not to like this, and just to open up because you've probably been doing too much of this, right? So give your body some variation in the other plane. You can it also might be kind of weakening some of the muscles there, or getting them when a muscle sits in a spot for too long, it tends to get kind of weak and tight. So I've actually given some of my clients or patients a really light exercise band that they can kind of just like I talked about these exercises, they can kind of just take a break and pull it apart 10 times, do some of this, and it gets those muscles firing a bit, just to give it some variation and give it a break from that. So yeah, but probably specifically your question, it's probably gonna just make you feel tight and stiff kind of in this sense, right? So just try to work the other way, or of course you could try to get a position where you don't have that as much, like a standing desk or something.
And something like Cobra, does that counter, would you say?
Yes, Cobra is fantastic. It does lots of good spinal extension, and probably feel really good when you do that, right? Yeah.
Thank you.
Did I answer your question?
It does, thanks.
Perfect.
We got way in the back, Rajesh.
Can I get closer?
Hey, hello. Have a shout.
Not romantically so, just
Cool. Wait, here? Okay. Oh, wait. Oh, you gonna hold it? Okay, cool. So I've got osteoarthritis in my right hip, and I'm missing some cartilage on the outside part of my right knee, and it's gotten to the point where it's worn out the cartilage in my hip. So it's basically just bone grinding on bone. The doctor said that I will need a hip replacement, though I'm only 46. So they said they don't want to give me a hip replacement this young because they'll have to do it again and there might be complications of it in the future. So they've recommended physio, and I've got a couple of places that I'll be calling next week. In that interim though, what could I be doing in order to ensure that I'm doing the proper exercises so that I don't have to prolong the amount of time that I need in order to get surgery?
In general?
Yeah, in general.
Well, in general, osteoarthritic hips and joints alike, they like to, even though it can be a little sore for part of it, they like to move and exercise. So if certain things are too painful, maybe avoid them. But even things like cycling or trying to walk more or trying to spend less time sedentary would be helpful, because essentially joints get their nutrients and remove their waste through movement because they don't have a direct blood supply. So if you're doing a lot of sitting around and stiffening up the joints, it doesn't really help your cause. So if you could do some cardio and then maybe even some resistance training, get some bands, do some squats, find something that works for you where maybe it's a little sore but not too bad, and then but it feels good after you done a few weeks of it, right? That's probably your best bet. So keep it moving. More movement is good. Resistance training has been shown to help. So 2-3 times a week, if you can do some sort of leg strengthening stuff, you might even reduce your pain, and you could potentially delay, or who knows, maybe stave away the surgery.
Okay, cool.
Can't guarantee anything though.
Okay, I
Yeah,
get it.
does that answer your question?
That does.
Okay,
Amazing. Thank you.
you're welcome. Hello, Josh.
Actually, I just wanted to share that this was really impactful for me. I do a lot of, thoracic extension through powerlifting and deadlifting.
Oh.
and I get really sore in my back when I'm sitting with a really upright posture, and I don't give myself permission to slouch, even though it feels amazing.
I give you permission.
And that's what I'm taking away from this is to, if I'm getting this right, move my body more when it's feeling sore. That's a signal saying, hey, don't be in this position anymore, but also keep track of when that's happening. And if there's same areas are getting sore over and over, then there might be a more long-term strategy to address it. But in the meantime, listening to that and moving out of that position.
Yeah, I think you're right on the money with that, and it's a good example for the audience because like most people think they got to bend backwards, but for you, it sounds like you need to allow yourself to bend forwards a bit more because both movements are good. We don't want to demonize any one position or any one movement. It's just different people need different movement variation, mobility, etc., based on their needs. And yeah, I'm glad you could learn something simple and easy from that. So maybe you'll be feeling a little less stiff by slouching part of the time.
Totally, I'm excited.
I'm excited too.
Awesome. Anyway,
I have really tight glute muscles because I've had two lower back injuries. What exercises would you suggest I could do? I do sit a lot at work as well.
My favorite one right now is pull-throughs. You like got a band or a cable coming from like a low position, and you're kind of like the cable's coming that way, and you pull through and stand up. So you're using your hips, like the cable's coming from behind you, right? And below, low. Try that one. Just do it once a day. If you can, I don't know if you have access to cables or a gym, but like I give people a band that they can loop around somewhere. Maybe buy a cheap band or something. That's good. Huh? You can use a kettlebell for like similar deadlift type things. It'd be a little different because you'll be lifting it up, but that's a good one too if you have a kettlebell. The pull through specifically though is that the force is coming from there, so it's just a bit. They're both good. They're just different movements. Or like you could always, if you don't want to get equipment and you want to be as simple as possible, you can just do like squats and bridges into single leg bridges. But I really like the pull through. You can talk to me later about it. I'll show you. Yeah.
I got
Yes.
a question also. So I was born with weak wrist muscles, and then just recently, maybe like a couple of years ago, I was like lifting weights, and I guess I lifted too much weight, and I got tendonitis in my left wrist. It's better now, but I was wondering what type of exercises I can do to strengthen my wrist muscles so I can pick up things, because my hands always shake just because of my weak wrist muscles.
Mm-hmm. Like weak, like this way?
Yeah, like kind of like flexing like that.
Oh yeah. So you should progressively load it with weights, but like you start slow, like I don't know, something like where you get tired after 10 sets of 3, and you do it every second day, not every day, because the tendon like needs to be challenged and then relaxed and then challenged and then relaxed, and then over time it will get stronger as you increase the weight. Okay. You might just want to pick a safe point because you're not really used to it, so pick low to start. Yeah, like the tendon, especially, it'll increase your strength, and then tendons specifically, like they respond to load. So like a tendon's language is load. So you gotta progressively load it, and then that'll probably translate not perfectly, but to your daily like activities.
Okay.
Yeah.
Thank you.
Yeah, you're welcome.
So my question is specifically with regards to like back pain, and I think in the past when people have back pain, you say rest. So I'm curious now, is that still what you're recommending for people, or is it to actually move through?
The rest is almost never recommended, only in rare cases. Usually it's to like keep moving. It depends how acute you are. Like if you can't walk and you have pain shooting down your legs, well, you still shouldn't rest, but you might not do as much. Usually like you want to move through it a bit, as long as it's not debilitating you. Like mild pain is okay, like start to get back to your activities. The like glute activation is pretty good a lot of the time, like with the pull throughs or just bridges, even if it's simple bridge or like cat camel or some simple mobility stuff, keep it moving. This is only general advice. It won't work for everyone, so you should consult like a physio or something if you're not having good results, of course. But in general, you want to kind of gradually get back to moving, and almost never recommend bed rest. Only like spinal injury or something we recommend bed rest, like when you can't move your hand, like yeah. But yeah, we usually tell people to move.
anyone else?
Just had a quick question on what your opinion is on inversion tables. About your opinion on.
Inversion tables. it's a preference thing. With all passive therapies where you're getting something done to you, I kind of see it as a relieving factor that can be used as a part of an active management program. So it works for some, maybe it works for some, maybe it doesn't work for other people. And I don't have any real strong opinions on it otherwise. Yeah.
So I've just got a question about lower back pain. I teach yoga, so I know like yoga poses that can help, but just in relation to what you just shared with us, something that you can do sitting, at your desk that doesn't kind of totally interrupt your day. Do you have any suggestions? But my lower back pain is exacerbated by sitting, so obviously getting up and moving is one of those things.
But when you stay seated, yeah. Oh, specifically for the low back.
And include like when you're on an airplane, for example.
Oh yeah, I mean like
15 hours.
yeah, you could do the ones I talked about. They're more thoracic. They still will help. I mean, you could do like the extension and the extension in the low back, like just by pelvic tilts. Your hands on your hips and you just push your stomach out and tilt and get it mobilizing like that. That's a really simple one you could do. Make sure you do enough. Do them every hour, every half an hour. Do a bunch of them. Probably won't. If you're sitting on a plane for 15 hours, there's only so much you can do. But you can even do stuff like pushing on your legs and resisting. It gets your hips firing. You can do like push on the outside, hold for 10 seconds, 5-second rest, push again, do it like 5 times, and then push on the inside. Or if you're in a plane, I don't know, maybe you can do like kind of squats, maybe, just plane squats or something. And then so those are just a few examples. I think probably the best you could do on a plane without.
You will
Yeah.
find me doing yoga poses down the aisle on the plane. But
That's amazing. I like it.
when you're just sitting,
Yeah.
you don't feel like you can get up.
Yeah, you can't do it the whole plane ride. It's got to get the carts through and stuff. Yeah.
So I have a unique situation. I was born with a bit of a birth defect myself. I have an extra vertebrae in my lumbar and one less in my sacrum. So I only have 2 fused vertebrae. So I have to be very careful in what I do. If I don't work out, my back goes out. If I work out too hard, my back goes out. So I weight train daily. But what I'm finding lately is, that's why I stand a lot, is my right butt cheek gets really, really sore. And I have a long drive home tomorrow. But I've tried the tennis ball, I've tried the golf ball, I think it's probably, I do lots of training, but maybe is there a stretch I'd be needing to do or
I would more than likely give you like some sort of single leg control exercise rather than a stretch. Do you do a lot of single leg work where you like lunges, or do you do like this like yoga one, like this one?
I'll do that when I'm like trying to do my cool down. A lot of times I'll end up trying to doing some balance work and stuff. Like I've tried to like do so many different things, but it just seems to be getting worse over time, and I'm not sure why or what's going on with that. So I thought it was maybe a stretch I need to. I'm not very good.
I wouldn't think it's a specific stretch. It's probably more of an individualized thing. Probably have to look more into it. I would try to just really do some more single leg control stuff. Maybe you do it, but maybe put more emphasis on it. And you could do this stretch. This is a good stretch for like single leg stuff. You just I do dynamic stretching more than holds.
Oh, okay.
And you just kind of keep your legs straight and it stretches the back of your glutes and your hamstrings. You could do that one. It might not fix it, but I don't think there's any specific magical one that's gonna necessarily help. But if I were to think, single leg strengthening, maybe put some more emphasis on it, because then you won't have any compensation or anything.
Yeah, maybe I shy away because my right side's a little less stable, so maybe not.
Yeah, and use the weak side to set the reps, and then the other side just does the same reps. Yeah, yeah, you're welcome.
I have migraine, and I have chronic very tight neck and shoulder since I was high school. And then I have migraine about 3 months probably from a lot of screen time recently. And if you have anything for my migraine, neck, shoulder, this exercise really helped.
Mhm.
But if
Oh, this
you
one?
have anything else, yes,
Yeah. Did you see the neck one?
yeah, I actually do that too.
You do that neck one too? Yeah, migraines are tough because they can't necessarily be fully explained by like bones, joints, and muscles, like physio-treatable things. You could get like, I mean, you could try to like put a soft ball in the back of your head and like lie on it and release it for a minute or two. Don't press too hard. Something like that. That might help. Or you could do some strengthening exercises for here. Sometimes it's not like stretching all day that helps. Sometimes it's tight and weak rather is what you need. You need to strengthen. So maybe try a ball. Try doing a simple band exercise. You know, like the ones I talked about, and then keep up the other ones, the mobility ones. But yeah, it's migraines are a little more tricky. Sometimes they have multiple factors, right? But it could mitigate it. Is that okay? Yeah. Okay. Okay, thank you. Oh, you want to say it?
Nope.
Okay.